it's very easy to jump on the bandwagon. For instance, in Oregon, as you may know, in 2009, the legislature set up a entity called the Oregon Health Authority, and it was tasked with three things. It has three objectives, and the objectives, and this is kind of government working. They want to get the people behind it. So the three objectives are to improve the lifelong health of all Oregonians. Well, who can be against that? I mean, everybody in this room, everybody in this state, everybody in this country, what an ideal. The next thing that they are tasked with is to increase the quality, reliability, and availability of care for all Oregonians. Again, it's put in a measure that no one can argue with. And the third is to lower or contain the cost of care so it is affordable for everyone. So this is politicians at their best. They put three ideas forward that no one can argue with, but it's like saying, I'm against pain, and I think you should have a life without pain. And I think that's a noble cause. All three of these are noble causes. Yeah. I mean, I won't argue that at all, but one, should government be in control of that? And even more importantly, can government deliver on that? And what is the price? What is the price you pay if you tell to your government, I want you to make my life pain-free. I want you to guarantee me, this is where you get into the rights issue, but I want to have health care, the best health care, affordable health care. I want to have the best health care and the best health I can have all my life. And I want government to make that a right, so I guarantee that I get that. I mean, I'm a human being. I'm entitled to that. That's a basic need. That should be a right. And I say, how much are you willing to give away? How much power are you going to give to government so that they can make you sure that you don't smoke, or if you do, a certain amount, or you don't drink, or you're not obese, or they define what health is? So when you get down to the basic problem, it's not the ideals. The ideals, they're noble ideas, and I think we should work toward them. And as a physician, I work toward them individually and now in a community. The problem is what is the cost? Not in money. Money's important, and we can get into that. But what is the cost in actually in our freedoms? Yeah. Well, and I think that is one of the basic issues, and it's very easy for a politician to say, I'm going to give you your health. I'm going to give you less cost. I'm going to give you more care. I'm going to take care of you. And for a lot of people, life is so hard, they say, thank you, take care of me. But then the question is, what do you have to give the government? What power do you have to give the government to take care of you?
Yeah. Well, you're just switching one business to another business, and the government is just getting huge. Now they own car companies and one thing after another. Schools. In the way of favors. And unions. Kind of indirect on.
Well, this gets down to your lifestyle. It gets down to your family's lifestyle. If you're going to give the government the role to provide you with lifelong health, and they define what health is, then you're giving them the power to come into your life and say, you are not living healthy. Now, if you've tasked them with making you healthy, then you have to listen to them, and they may say, well, you have to exercise, you have to eat right, you have to not do this, not do that. That's the question we should be having. It's not a question of, do we want these three objectives? Of course we do. But again, there is a price to pay for everything.
Yeah. And I certainly don't think so, but somebody could think Obama's the nicest guy in the world. Like you said, you're not ideologically driven. You're driven on health. But what happens when you get the next president or the one after that who is a terrible, evil partisan that wants to control you even further? All of a sudden now we gave them that right for the control over our beings. So,
well, I would say whether it's Obama or whoever the president is, it's a government. Yeah. It's a government. I mean, obviously President Obama has his agenda, and we can sit here and argue whether we agree or disagree. And I have some real issues with his agenda. But that's a political discourse. But again, getting back to, for instance, the federal health care reform. Now, they being the Congress and the President, said everything would be on the table. This is too important. I remember many times I was told, and we were all told, that this is too important. This is healthcare. This is too important for politics. How many times do we hear it's too important for politics? Politics will not get into this. Well, for a politician to tell me that politics won't get into anything, I immediately say they're not intellectually honest, because they're politicians.
It always does.
It always does. I mean, that's just the nature of the beast, and you can't take that out of the beast, and that's the way it is. So you have to steer it in one direction or another. Now, in the discussion about healthcare reform, one of the large areas that was not really looked at all was the medical liability situation, and that encompasses defensive medicine. When doctors order things to feel like they're protecting themselves from a lawsuit, they may not actually be able to do that, but they feel they do. There have been studies that have shown over 85% of the doctors in this country admit to ordering tests on people and doing things to people for the only reason of defending themselves against a potential lawsuit. Now, I would dare argue that if 85% of the doctors admit to doing that, probably 100% do it. So if you have 100% of doctors doing something specifically to defend themselves against a liability suit, that's a problem. And yet the previous Congress and President Obama, that was not on the table. Now, President Obama did throw $50 million into the basket in a plan that cost over $1 trillion. Some people say
from his own pocket.
Over $2 trillion. But that was to kind of satisfy those who said we need to look at medical liability. And he said, well, that's just to look at it. But if you examine that situation, defensive medicine, which 100% of the doctors really admit is happening, so no one can argue honestly that defensive medicine doesn't happen. A study out of the Harvard Public Health School, which is not a real right-wing organization. No one's going to say that they're driven to get government out of healthcare. Okay.
Are they nonpartisan?
Well, they're supposedly nonpartisan, but again, depending on how you look at them, some would say they're more. They lean a little bit more toward socialized medicine and sort of government control. And this study was done by a professor of law. So we're not talking about some group of doctors trying to make it look like, oh, the poor doctors are in trouble. So that study said that there was $60 billion a year wasted in defensive medicine. Other studies have talked about it being as high as $200 billion a year. So let's take middle ground and say that you've got $90 billion wasted a year in defensive medicine, and yet our government, this government that was going to keep politics out of the problem, okay, was only interested in your and mine health, only interested in trying to get a low-cost product. Somehow, Harry Reid said there's not enough money in medical liability system reform to even look at it. And Howard Dean said that the problem of looking at medical liability was that it was going to upset the lawyers, and you can't upset everybody.
Yeah.
And so
you can't upset the lawyers.
And so you have $90 billion left on the table. And I would say that in a system where they were talking it's going to cost somewhere between $100 and $200 billion a year to do it, they could have fixed the malpractice situation, and they might have saved $100 billion a year.
Yeah, but that wasn't their interest.
To not even to look at it, I think, is disingenuous. Yeah.
Yeah.